Imagine trusting a treatment because you were told it was safe. Imagine believing the words "no serious side effects" and then watching your pet decline. Confused, weak, suffering, while being told it couldn't possibly be the drug. Pause. This is the story of blind trust, ignored warnings, and the growing number of pet owners asking the same question. Why weren't we told everything? The promise. When the arthritis drugs Librela for dogs and Solensia for cats were introduced, they were marketed as breakthrough treatments, monthly injections, targeted pain relief, no daily pills, and many veterinarians genuinely believed they were a major step forward. But somewhere along the way, something troubling began happening. Some pet owners were told, "There are no real side effects," and that statement simply isn't accurate. Because no drug is without potential risk, the science, both Librela and Solensia, belong to a newer class of drugs called monoclonal antibodies. They work by blocking nerve growth factor, a protein involved in pain signaling. In theory, this reduces arthritis pain, but blocking biological pathways can also affect other systems, and that's why regulators require warnings. The official prescribing information for Librela clearly states caution should be used in pets with kidney disease, liver disease, neurological disorders, because in compromised animals, the body is already struggling. The problem with older pets, and this is where the conversation becomes uncomfortable, because many of the animals receiving Librela are older dogs. Senior dogs are far more likely to have reduced kidney function, liver changes, neurological decline, underlying disease. So when people claim Librela is the best drug for older dogs, that statement ignores a critical fact. Older bodies are not resilient bodies. They are often fragile systems already under stress, which is exactly why the manufacturer includes these warnings. The growing debate across veterinary communities and pet owner groups, the discussion is growing. Some veterinarians remain strong supporters of these drugs. Others are urging more caution, better monitoring, and more transparency about possible adverse reactions. Reports submitted to regulators describe symptoms such as weakness, neurological changes, mobility loss, lethargy. These reports do not automatically prove causation, but they do raise questions, and science moves forward by asking questions, not silencing them. The dangerous phrase, one phrase keeps appearing in online discussions. That's just scaremongering. But questioning a medication's risks is not scaremongering. It's responsible. Every medication ever created has risks. Every responsible medical professional understands that. Why some lie about that is another video. Blind faith in any drug, human or veterinary, is not science. It's belief. The real issue. This conversation is not about attacking veterinarians. Some vets truly want the best for animals. The real issue is informed consent. Pet owners deserve to know potential benefits, potential risks, manufacturer warnings, monitoring recommendations, because once a monthly injection is given, it cannot be taken back. The pets at the center of all this debate are animals, dogs who cannot speak, cats who cannot explain what they feel. They rely on us to ask questions, to research, to advocate, and to never let loyalty to a drug override loyalty to them. So if someone tells you there are absolutely no side effects, that should be the moment you ask more questions, because science is never absolute, and the animals we love deserve careful decisions, not blind trust.